This week, my surgical skills are tested as I undergo a mammoth procedure in a last attempt to remove a nasty cancer from an elderly dog.
Absolutely horrible. It's not going to be easy.
I make one of the most difficult phone calls you can make as a vet.
It would be remiss of me to not put forward the option that would give you cure, which is the consideration of amputation.
Oh my God.
And it all hits home as I'm reminded of my own dearly departed dog.
I lost my dog and I have never felt sadder in my whole life.
I'm Dr. Scott, and this is Rescue Vet.
No.
Royston and Laura have been clients of mine for the last 14 years. But more than that, they've now become my friends and are loving owners to 6 brilliant dogs.
We have 2 pugs, a Shih Tzu, a Beagle, Betty the Springer, and this is like a red fox retriever that might not be a retriever, could be a Labrador. Don't know really the difference. But yeah, I think that was everybody. Yeah. A lot of work with 6 dogs, but I wouldn't change it. It's great.
We don't have children, so the best for us is to have dogs. For me, they are everything.
Betty was our first dog. It was brought as a birthday present for me by Laura 14 years ago. Total surprise. It was great. It is the best birthday present I've had, yeah. Nothing is gonna compete with that, I don't think. Betty is, for me, is everything. I don't really know how to put it into words. It's the thing I love more in the world, I think. Yes. We just done everything together.
She's grumpy like him.
She's
She's exactly the same as him.
exactly the same.
Exactly the same.
Yes.
Bunny female dog.
Betty's 14 now. She's a lot slower than she used to be, but she still likes walks.
A few years ago, Royston and Laura brought Betty to see me with a nasty lump growing on her leg. After a biopsy, this was diagnosed as cancer. Having removed the lump a few years ago, last week they called me with some worrying news.
Everything seemed quite good. It seemed good for years and years and years. And then suddenly it's come back again, but it's come back and it's grown really rapidly, doubled in size in the last few weeks. So yeah, I just put into panic mode pretty much instantly.
After examining the lump again, it's clear Betty's cancer has returned. We've collectively made the decision that despite her age, the best option is to remove the lump one last time.
Everything that involves Betty, I worry about. That is on my mind. The age, I mean everything. What is actually in the lump, the surgery of the lump, everything. The worst thing for me would be to lose her. But I know Scott, and I've known Scott for a long time. I personally wouldn't choose any other vet. I trust him more than anybody else, and she loves him.
And I love him. He's very handsome.
She's always hugging him.
I love him so much.
It's nice that I can always expect a hug whenever I see Laura, and today, being the big day of the surgery, I think we're all going to need a hug.
Right. Hello, lovely lady. How are you? I'm good. How's that other lovely lady? Hello. How are you? Hello, lovely lady. How are you? You're right.
I'm good, thank you.
Good to see you. Hello, baby. Hello, my baby. Mwah. How are you? Oh my God. That's got bigger since we last saw each other. Hey, we all love you so much. That is enormous. Yeah. All right, let's get into the consult room, shall we? And have a little look. Have a little look. Yes. Come on then. Come on. You know where you're going. Come on. All right, so can we pop our lovely lady up on the table,
Yep.
please? Hello, baby. Oh, you're such a good old girl, aren't you? Yeah, wow. I mean, it's visibly probably twice the size, I would imagine, since I last saw it. So it's growing really quickly. It feels sort of like a bunch of really large grapes that's just sort of accumulating. And now there's actually one that's on the inside as well. So good. And that last surgery, I promise. Yes. The fact is that we have got a tumor here that's a sarcoma. So that is a malignant type of tumor, but it was graded by the pathologist as grade 1, which means that it's less likely to spread.
Yeah.
Okay. But it had a really high mitotic index, which is the ability for it to grow. And that is pretty obvious in the fact that it's doubled in size in just a few weeks. What that means is that actually going in to try and surgically remove it, a small margin may also still be effective because of the fact that the spreadability of the tumor is so low.
The vital part of this surgery is trying to achieve margin to stop the cancer from coming back, but it's impossible to know until I'm in surgery whether this will be even possible. On top of that, being an older dog comes with extra concern, as Betty is more at risk under the anaesthetic.
Now, we have already done the bloods. The bloods are amazing, and that shows that age is just a number, because she is still vibrant and full of beans. So she's still living her best life. And that's why we're all here today, isn't it? To try and continue that journey together. I don't think I've ever seen you look more nervous. How are you feeling today?
Very worried, but it's in good hands. I always believe in you, and I think it's the best option because she's suffering with that thing in the leg.
This certainly isn't the first time that we've been here. And you know, the wonderful thing about the various patients that we've treated collectively is that we've become friends off the back of it, which is pretty cool. But for me, obviously, it does add that little bit of pressure of going, you know, it's a dog called Betty to start with, which absolutely twangs at my heartstrings because of my beloved heart dog that's now passed, who was called Betty, as you know, and she was about the same age.
Really?
So, yep. So, wouldn't be doing this unless I thought it was the right thing to do. And also, if Betty was still here and she had the same thing, would I do the same thing for her? The answer is yes, I would, 100%. I've got the full team. We're going to have 2 vets in surgery. We've got 3 nurses. So we've got the whole team here focused solely on her.
Thank you so much.
Oh, well, don't take me just yet, but let me hug you because I don't think I've ever seen you look so frightened. You look so frightened. Don't be frightened. It's all right. I'm here. All right, I'm here. We're going to do it. It's going to be just fine. So I think let's just get it done now, team.
Yeah.
Go team.
Before I change my mind.
Say goodbye to mum and dad.
See you soon.
I love you, mummy and daddy. All right. All right, team. See you later. Don't worry.
Thank you.
It's okay. Don't worry. It'll be okay. I should. Bye, guys.
See you later.
See ya. All right, mate. Take care. You made mummy cry. Okay, let's not make mummy cry. Let's go.
It's never nice seeing owners leave my consult room in tears, but it just shows you how important Betty is to Laura and Royston. And I understand that, as it reminds me of my beloved dog, Betty.
Yeah, but I lost my dog. I lost not even just the dog, I think it was the soul that I loved, probably one of the most in the world ever. And I have never felt sadder in my whole life, if I'm honest, than when I lost my dog. I don't know what that says about me, but that's how it was. And so to this day, I think about her all the time. And so obviously when a dog comes in called Betty, who has a bit of vintage, I immediately think back to my dog to see the look that Royston gives Betty just reminds me of the relationship I had with my Betty. That love, that bond, that connection is just something that's just so special. And I want to make sure that he gets to enjoy that bond for as long as he possibly can. And I want to do my very best to make sure that Betty stays around for that little bit longer. Hi, Sandra.
Hello.
So this is Betty,
Hello, Bessie.
who is
Hello, baby.
a 13-year-old. She is a baby. She's a big baby, much loved baby, with a sort of a baby growing on her elbow.
Oh, that's
Yeah.
not good.
It's pretty grim. The big issue with this girl is obviously her age, the fact that she's an old girl.
Bless you.
Yeah.
Oh.
Yeah, major surgery on a dog that's had a lot of health issues, but she's still here. So we just need to do our very best today. The last chance, Celine, this surgery. Certainly know how Royston feels. His Betty is in danger, and I just know how hard it is at this time of their life to try and do the right thing by them. It's really difficult. I think that's a big thing, isn't it? Just with dogs, is you just don't want to lose them. And you want to make sure you make the right choice, and it's just really hard. That's why, the trust that people put into their vet is just sacred, That they can trust me to do this is, it means a lot to me.
Well, we'll do our best.
We
won't we?
absolutely will, yes. And I think we've got a great team today. So it's 5-on-1 today, Betty. That cancer's got no chance, does it? No. Let's get it off.
As I'm sedating Betty, it's not long before I see worrying signs of an older dog under anaesthetic.
Could we just get the pulse oximeter on her, please? Thanks. See how the colours improve just by doing that? It was just a little bluish, so I'll just throw that in there. Okay. Yeah, settle down, colour's better. So yeah, no, I'm as happy as I'm going to be, which is not hugely happy until it's done and she's woken up. It's one of those things that we just being super careful, super cautious, super that. She went down very, very deeply to the sedation, deeper than you normally anticipate, but she is an old dog, and I have actually reduced the doses to be as low as possible, but still she's just very, very low. Okay, all right, so I think while those fluids are running, we'll get the rest of the team in, we'll have a bit of a team briefing, and then we'll get going.
That's fine.
Okay. So, already we've seen that her colour wasn't super great. So she's gone really deep with the sedation. So it's just, I think anaesthetic-wise, we're going to have to really be on our toes, okay? So old dog, last surgery I'm sure we'll ever do on her, so let's make it a good one. All right? It's really important today that we bring together a full team and that everyone is very clear on their roles, because we need to do this quickly and effectively, but also ensure that everything is done to the best standard that we can. So Ella's busily clipping away at the leg while Sandra is monitoring the anaesthetic. Gina's getting all the surgery ready, and Tomas is also going to be my veterinary assistant. He's going to be not only there to help control the bleeding that goes on in the surgery, but just to sort of be my extra pair of hands and eyes, and I'm managing the whole lot. We've got a great team here, and we work together really well, so Betty's in good hands. So it feels like it's time to get the gloves on, get the gown on, get the mask on, and get into surgery.
So it's quite an intimidating beast looking at it. It's a little bit daunting. So you can sort of see it's bursting out seams all the way through here. It's bursting out. Oh, that's deep. So I'm just doing my initial skin incision, and it's challenging because the tumor is really close to the surface and it's just wanting to spew out. It's not going to be easy. Hope that I was going to be able to sort of scoop them out like a bag of marbles, but there's virtually no bag. And the marbles are all disintegrating. So I think actually it's going to be a job for my finger. It's so friable or breakable that I kind of need to feel my way through this surgery rather than cut my way through it. God, it's just horrible, isn't it? Tumor is just, sort of has a consistency of like putty. You know, it's not something that you can sort of really properly grab hold of. It just sort of breaks in your fingers, and that's exactly what I'm dealing with at the moment. So 1,000,000 times harder what we found than what I'd hoped for. At the end of the day, what I'm removing is a cancer, and cancer doesn't work to the rules. There are no rules. They grow without rhyme or reason, and this thing is just the personification of cancer. It's just horrendous and ugly and just awful. So it's yeah, it's not easy. This is not easy.
I've been in surgery for nearly 2 hours and things still aren't looking good. So now I have a tricky decision to make.
This tumor is just not playing ball at all. It's very friable, which means very breakable, and you can't find a clear line between healthy tissue and unhealthy tissue. So I'm basically kind of almost scooping it out. So I think what Tomas and I believe is that actually we're not going to be able to say, hey, we've removed this tumor. All I've done is what's called debulking. So I've reduced the size of the tumor, absolutely, but I can't say at all that I've removed all of the tumor cells. So I am going to approach with then the possibility of amputation. I'm pretty certain that they're not going to want me to amputate her leg, but obviously I'm going to give them the option while she's on the table, which sucks. Really horrible side of the job, because you kind of, you know, you obviously go by science, but then there's also your heart and what you want to happen. And what I wanted to happen is not what I've got. So there you go. It's life, isn't it? So if we can just get the owner on the phone then, please, that'd be great. Hi, Laura, it's Scott. Hi. So, yeah, not awesome. She's fine. She's doing very well under anaesthetic. I'm struggling a bit more, however. The tumor is just really nasty. It's been really, really difficult to remove. I know for sure that I won't be able to remove all of it. I am being quite fastidious, because that's just me, and doing my very best to remove as much as I possibly can, all that I can see. It would be remiss of me to not put forward the option that would give you cure, which is the consideration of amputation.
Oh my God. Don't worry about it. Just move as much as you can. Let's see what happened, doctor, no?
Oh, yeah, I honestly thought that's what you were going to say, and that's also what I think should happen. But obviously, you know, I need to give you the option of potential cure, but I just don't know if Betty's got it in her to be a three-legged dog at her age. I'll continue to do my very best. I'm removing as much as I possibly can, and hopefully we'll have it back to you very soon, okay? All right, okay, speak to you soon. Bye, bye. So to have conversations like that with owners, you know, and it's just, It's actually really kind. What she's done is just to say, do your best. You know, and she knows that I would have done my best. So it's just disappointing, you know, because you're seeing something where you know that that's going to be the reason that this dog isn't around for much longer. And I couldn't fix it. So that is not a nice feeling. There you go. Mas and I've spent the last nearly 3 hours scraping all the tumour that I can see. That doesn't look too bad now, you know, it looked horrifying before, and that looks all right, so.
As clean as it gets. So
It's as good as it gets, isn't it? Yeah, so it's time to close. Right, so that's the last staple, so it's 3.5 hours, but we are all done. So time to wake her up. Tired. That surgery was epic. It was just such a long one and really challenging, just twists and turns along the way, and just not something that I expected. So it really was tricky, yeah. I'm normally pretty cool, calm and collected in surgery, but when things aren't going my way, I do get a bit frustrated. I think all surgeons probably throw their rattles out the pram from time to time. It was just the case that this tumour wasn't going away easy. It was giving a good fight. We've given Betty the best shot we can. We haven't given up on her just because she's an old dog. It's a bit upsetting. I couldn't be sure that I've resolved this Betty's issues because I'd do anything to bring my own Betty back, I suppose. Yeah. But I think what we have done is to definitely reduce the size of the tumour, hit it as hard as we can, give it our very best shot, and all collectively hope for the best. Fingers and paws crossed. Good girl. Hey, good girl. Good girl. Mm-hmm. Betty's now slipping off the anaesthetic, and I really cannot wait to reunite her with Laura and Royston. Betty's been recovering well at the practice and is finally ready to go home and be reunited with an anxious Royston and Laura.
I'm relieved it's over. It was an anxious way. I was nervous for every second of it.
Just looking for her the girl back home and look after her, spoil her, and make sure her recovery is the fastest possible.
The ultimate goal is for Betty to be good, fine, without any problems. The best outcome for the rest of her life.
Hi, here she is. Here's your baby. The leg is now normal size. It's got a bit of padding there. And I sort of spent another 2 hours or so after I spoke to you, kind of just clearing as much as I possibly could from the site. I can't say 100% at all that I've removed all the cancer cells, because cancer cells are microscopic and I haven't got microscopic vision. So I've just removed absolutely every single thing that looked even vaguely like tumour.
Yeah.
So all I've done is just my absolute very best. So let's just fingers crossed, paws crossed. Okay.
Yes, yes. Look at the difference. Ah, look at the difference.
Yes.
Thank you very much. Thank you.
Tony's looking, he's looking.
Thank you, that's made my day. I'm knackered after that surgery, so that was very nice, thank you.
Thank you too. I don't know how to say thank you everything.
It was a full team effort. Everyone was there watching this dog to make sure that she got through. So it's a big team effort, this one. Bye-bye, baby. Hey, bye-bye, baby. You did so good today. Didn't you do so good today? Yes. It's always so wonderful to be able to hand back a beloved pet into the arms of their owners, particularly ones that show so much love towards them. All right, see you guys later. Bye, baby. See you soon. It was a big, challenging day today for everyone involved. Oh, lovely. And I've put my heart and my soul into it. So I hope my Betty is out there watching over this one to make sure that she gets through it safe and that nasty cancer doesn't grow back.
One month later, and I'm meeting Royston and Betty to see how they're getting on.
Come on, good girl.
Hello, hello.
Look, come on.
Fancy seeing you here.
How are you?
I'm good, how are you?
Good.
Hello, baby. Hello, my puppy. How are you? Mwah. How you doing? You all right, mate?
How are you doing?
Yeah,
Nice
yeah,
to see you.
very good. Hello, baby. Hello. Hello, look at you. John, I'm looking at your legs now going, which one was it?
Exactly. You can't really tell anymore.
The difference is phenomenal
Yeah.
in that there is no difference now.
Exactly.
Yeah?
It's like nothing happened,
Yeah?
although a lot happened.
Yes.
Yeah.
Can I have a little look? Look at that. I mean, that's gone, hasn't it? That horrible cancer. It's better than I could have even hoped, I think.
Yeah, I agree.
That surgery was quite a epic decision between the three of us, but coming through it and out the other side, it feels like we really did the right thing.
It was the perfect decision and the perfect person to do it, because I wouldn't ask for anybody else to touch my dog.
Oh, thanks, mate.
Except for you. So yeah, I have a lot of trust in you and what you would do and what you've achieved. So yeah, thank you for everything.
I am just so happy for Laura and Royston, but of course for Betty, because her leg looks beautiful. It really is a privilege to do the job that I do. And in the case of Betty, I've been able to give her more life on this earth, which is quite amazing, really. And to know that she's now comfortable, she's happy, she's running around the park, she's back to her normal self. And that means that she's going to have more unconditional love with Laura and Royston, which is just, it's a special gift to give. And yeah, I'm chuffed. It's amazing. I'm so sort of glad, but at the same time sort of jealous, because I lost my Betty at 14, same sort of age. But you know, I'm just so glad that you can stay with your Betty.
Hopefully for a few years more. Yeah, a couple more years would be great.
That would be great.
Would be great. My focus for the future is now is just to enjoy the rest of the time we have together. Walks, play, everything to make her life as comfortable as possible and happy as possible. Laura's extremely happy. I mean, we both just love Betty and we just want the best for her in every single way.
You're such a sweetheart. You're such a sweetheart too. You're such a sweetheart. You are. But she's a big sweetheart. Yes, you are. Yeah. Yeah.
Laura's going to be jealous now. Just
Yeah, she will be
tap
jealous.
my shoulder and
Yeah,
say,
just pass that on from me. Just so clearly evident how much Royston loves Betty. And so it's just a gift to be able to give him more time with her. And I suppose in some ways I'm a little jealous. I'm feeling quite bittersweet about it, because I'd give anything to have more time with my Betty, but at least he's got time with his. Gosh, that's hard to say.
For more videos like this, please subscribe to the channel and turn on that notification bell to be the first to hear of all the latest videos here on Rescue Vet.